Breaking news, Channel 9, 22nd of February 2023. New South Wales Health apologised for sending 16,700 text messages wrongly informing recipients they had COVID-19. More than 60,000 people in New South Wales got a nasty COVID-19 surprise. Well, not sure how nasty it was. It's just a text message. You get them all the time. This week, when they were sent texts wrongly advising they've been tested positive for coronavirus. Gee, that's a blast from the past. It used to be called coronavirus before they had a name for it. They haven't called it corona. It doesn't say for the coronavirus that causes COVID-19. For coronavirus, as in, that's the name of it. New South Wales Health blamed a technical error. So it's nobody's fault, everyone, okay? So don't start asking any questions for the mistake on Monday. And said it had quickly sent follow-up texts to explain the unexpected notification. Pretty sure people would have worked it out for themselves. Isn't that just exacerbating sending them another text, taking up more of their time over nothing? Because really, the whole thing has been about nothing. So the messages detailed how to get antiviral medicines. Well, I haven't seen one of the messages, but isn't the incessantly pushed primary pharmaceutical product by the government? It wasn't antiviral, it was preventative. Like, go and get you safe and effective as soon as possible. Where's that? What to do if they fell seriously sick? Well, you know, as adults, I'm pretty sure they'll know what to do. They've probably fallen seriously sick at least sometime in their past. They need government to treat them like Oh, yeah. Anyway, they're onto it. They're going to be thoroughly investigated. Can't wait to see the results of that investigation. So it wasn't intentional to keep COVY in the news until the pandemic treaty signed. Spokesperson said the text should be ignored. Well, which one? The first one or the second one? Because if you need the second one, then the first one applies, which means you got a positive test for COVID-19. Just a reminder, they're still investigating it. They haven't actually solved it, so be warned. You could get some more of these texts in case the pandemic treaty so a few more headwinds and they need to extend it for a bit longer. Long COVID's another excuse for them to keep throwing COVID at us until this pandemic treaty signed.
Karen Henry caught COVID in January last year, and she's been suffering ever since.
The timing of catching long COVID coincides with the injection of safe and effective pharmaceutical products. Has an investigation ruled that out?
It's taken a lot from my quality of life.
The 62-year-old mum from southwest Sydney also has MS. Her case is complex and desperate.
Well, MS is a full-on diagnosable disease, not just a detection supposedly of some viral protein in your system. That would surely take a lot from her quality of life as she compared having MS and then weighed it up against COVID, and COVID is worse than MS. That's why she's here.
You're tired all the time, so you're running on empty all the time. Really short of breath, a lot of pain.
Well, do the three symptoms she just listed are also symptoms of MS. How did she know which one, and how do doctors know which one's causing the fatigue and the pain? And shortness of breath, well, she could increase the oxygen flow to her lungs by taking off that mask.
A lot of inflammation.
She's receiving care at the St Vincent's Long COVID Clinic, one of a handful of clinics of its kind nationwide. The wait to get in is 6 to 12 months. One
woman learning to walk again. That's how serious long COVY is. I mean, how many people are out there learning to walk again? I mean, I'm sure they didn't stage this shot for she's actually going through treatment. This isn't for the cameras. And you've got to wait 12 months to learn to walk again. Or, hang on, she said it was fatigue. Why would you need this equipment if you're just tired? Isn't this if your muscles are failing, like as in MS?
Their lives start to spiral out of control. So they come because they're struggling at work, but by the time they arrive, they've lost their job.
They've lost their jobs. How serious this guy is. He says, well, 100% of people have lost their jobs because of long COVY. That's what he just said. And they can't get in. Do they get their jobs back after they've been there? Or what's the point of going there?
The clinic has a team of respiratory doctors, nurses, psychologists, physiotherapists and rehab physicians.
Well, that's a litany of professionals, and it's plural. It's not just one of each. This was quite a big operation. And with a 12-month waiting list, it must be flooded with patients.
It's received hundreds of referrals, but only has the capacity to see 10 patients a week.
10 patients a week? For all those professionals, in this big facility with all that equipment, how intensive is the treatment that each person needs to get? I mean, look at all those vacant chairs. Could you squeeze a few more people in there? Losing their jobs, remember? This is really, really serious. We've just got this one girl who, I mean, sure, she's suffering, but she's it.
So it'd start with one of these.
Its funding was in limbo after a federal COVID agreement with the states ran out on December 31, but now it's secured its long-term future.
We're lucky here at St Vincent's to have some funding support from our hospital and also from philanthropic donors. That means that we can keep the clinic operational.
He doesn't mention the ratio of philanthropic donations in the hospital, which is us, how much we're paying for this. Now, he's a physician from that term starting with T, and he's third one on the list in that department at the hospital. So while the services don't specifically mention long COVID, I'm sure these services must apply to it. Fine needle lung biopsy, sleep service. I mean, which one of these are you using on long COVID patients?
There's thousands, if not hundreds of thousands of Australians that are suffering from this condition, so one hospital clinic is not going to see all those patients.
If for all this money, all you can see is 10 people out of 100,000, why would you bother? He actually said hundreds of thousands, and there wasn't any long COVID prior to the pharmaceutical rollout, but I'm sure there's no connection.
And so we do need to have a model of care.
Health Minister Mark Butler says it is clear we need to develop a focused national response.
Back before the pharmaceutical product rollout, the safe and effective one, we had less than 1,000 deaths of people over life expectancy, and the symptoms were just cold and flu. That's what the government told us. And there was no long COVID. And yet the response was to lock down 4 million people as soon as there was a detection of it. And now we need to develop a response for long COVID that is causing people to lose their jobs. I mean, where's the urgency? Back prior to the jabs, police were smashing people's heads into the ground in an effort to stop the spread of cold and flu. Where are the police now? I mean, the symptoms are worse now. We should be in perpetual lockdown until this long COVY's beaten, according to the precedent set.
Global studies suggest 5 to 10% of all cases develop into long COVID, but there's no national registry, so the exact number in Australia is unknown.
That's a bit confusing because the study suggested that there were 10%, but they didn't make a register, meaning they didn't find 10%. They're just suggesting it. You know, that kind of study, I mean, that wouldn't pass muster in a high school. The teacher gave her students an assignment, do this study, and they came back, well, what'd you find? We didn't find anything. We've got some suggestions. So after the study that she didn't mention who did it, when it was done, or how it was done, came up with, they still don't know.
If we don't have any idea of the size of the problem, how can we possibly manage that problem?
Well, before he said there was hundreds of thousands, and now he just says he doesn't know. I mean, where'd he get the 100,000 figure from? He only got 10 people. They said there was hundreds of referrals. So what, hundreds of thousands of people have got it, but only hundreds, well, that's less than 1 in 1,000 who've lost their jobs, because that's how serious the other doctor said it was. I wasn't getting statistics. I mean, these should be lining up.
When the acute phase came, we worked together, we put tons of money in it, we got a vaccine, we got sorted. Now it's the chronic phase.
Yeah, I probably wouldn't be laying the chronology out so clearly. This is what he just did. He just said we had an acute phase, which was cold and flu symptoms, apparently needed a police to lock everyone down. Then they had the jabs. Now there's a chronic phase. There was no chronic phase before the jabs. Oh, jeez. You know, you've got to be careful.
And there's just nothing.
It's a challenge. Long COVID is a challenge.
Yeah, what? And the MS isn't a challenge? Speaking of which, if the symptoms are similar and the treatments are similar, why doesn't she go to an MS clinic and free up one of the 1 in 10 for someone who lost their job from COVY, not from MS? What's she doing here?
A challenge as a country we'll need to face. Annalise Bolt, 9 News.
Oh, these reporters, especially Channel 9, did such a good job. Well done, Annalise. Just before I finish off, I was watching John Campbell video, Dr. John Campbell, and he showed 2 senators, Australian senators, on his channel, Rennick and a guy named Babette. So I hadn't heard of him before. And the Babette's guy, he made mention that Karl Stefanovic had said, I haven't seen this, that he would only take 2 jabs, but no more because of all the rest. I mean, he didn't take any, but they're projecting now that on the one hand, you've got one arm of the government media corporate monster, government saying we've approved up to the 5th dose, and the media saying don't take more than 2. Now, shouldn't Carl be censored? Channel 9 be censored for misinformation? Because if one of us had said that, seems like they want to half get the message out so they can go, well, the media did say, just on advice, they did contradict us telling you to get it. And their licensed media, the tricks and games they're playing. All right, that's it for this one.